Welcome on and all to today's meeting, uh, uh, and welcome on and all to the webinar series of Heartfulness Wellness. Myself, Dr. Vijay. I'm an homeopathic doctor, and I'll be moderating today's session. Today's topic is going to be on the World Pneumonia Day, which was on the 12th of November. That was last Sunday. So we have a special speaker with us today, and is Dr. Kunal Desai. So Dr. Kunal Desai is a full-time clinician in the field of infection and diseases as a part of large multitude plenary private group in Dayton, Ohio. After completing his medical school training in Surat, India, so he moved to United States and completed his residency and fellowship training at Wright State University. So in addition to providing infectious disease consultations at 4 different hospitals in Dayton area, Dr. Desai also serves as a medical director of employee health for Kettering Health Network and director of antimicrobial stewardship program at Soin Medical Center. So Dr. Desai has special interest in research to assess impact of heartfulness meditation practice and has published a research study on heartfulness meditation and its effect in lowering stress levels and improvements in sleep quality. He lives with his wife, who also happens to be an infectious disease specialist, and 2 adorable children. So, welcome, Mr. Kunal Desai.
Thank you, Vijay. Thank you for the kind introduction. I'm grateful to be here for this Heartfulness webinar series. Nice to see you.
Same here, Doctor. Nice to have you in our session today. So moving on with the session. So let's start with having some limelight upon what is pneumonia and what are the important symptoms one perceive when one suffers from pneumonia.
So, pneumonia is, if we put it very simply, pneumonia is an infection of the air sacs of the lung. So the alveoli of the lung, when it gets infected, we call that a pneumonia. Or in other words, it's a lung parenchyma. When it gets infected by different organisms, it can be bacteria, it can be virus, it can be fungus, it can be something else. We call that a pneumonia. Now, when we talk about symptoms, right, symptoms can be varied. There is and they overlap with other disease processes as well. So there are no specific symptoms where you can say, oh, this symptoms would be related to pneumonia. But if you ask generally, we would get cough, fever. If it gets worse, you can have shortness of breath. Children's, when they get pneumonia, that manifests differently. They stop eating, for example. They uh, may behave differently. Older age, when pneumonia happens, the symptoms may be different as well because they often get confused. They may not have many pulmonary symptoms when they get pneumonia, but they get very weak. They start having fevers. So it has a wide range uh, of symptoms if we just go by the symptoms. The interesting part to understand is why that happens. And uh, it's about balance between an invading pathogen's ability to cause infection and uh, our ability to fight that infection. So when that imbalance happens, that's when we get the pneumonia. So I'll give you an example. If we do not have an adequate flow, so anything in our system is related to flow. So simple thing is, let's say if we have kidney stones, right? and then if they get stuck in the ureter, in the connection between the kidney and the bladder, and everything backflows, and then you can get an infection because of that. In pneumonia, if there is not adequate flow of secretions, and many people have predisposing factors for that. So if in older individuals there's a COPD is one of the risk factors. When there is an inadequate flow, you are prone to get pneumonia. And it's a complex balance between a natural defense of the lungs and upper airways in order to get rid of the organisms that might trickle down in the lower lung, um, and the ability of the organisms, as the term we use is called virulence of the organism to cause the infection. When the imbalance happens, it can result in pneumonia, because many of the organisms we get exposed to in our upper respiratory tract, but we don't get pneumonia, right? So it's the other host factors, as we call it. It is our immunity level that determines why some people get pneumonia with the same organisms, why some others don't.
Okay. That's actually interesting when related with how many of us suffer with various upper respiratory tract infections but not get pneumonia. So, like looking into the symptoms, you said cough and fever, right? So, I mean, various other disease conditions also present with same symptoms. So, how can we differentiate it, from common cough and fever?
I think that depends on various factors. It depends. Then it comes down to, um, if you are looking at from perspective of an individual uh, who is suffering from that symptoms, and if we ask a question and say, oh, when should I worry about this being a pneumonia versus just a simple common cold, it depends on how sick you feel overall. And the second is, what is your general health looks like. So if someone has other chronic medical issues, emphysema, diabetes, depends on what the age is, then there should be a low threshold to be concerned that this could be involving the lungs and causing pneumonia. But if you're otherwise healthy, if your illness is still letting you function for the most part, then you can take some time and observe how you recover, if this is just a viral illness that you would recover from, or you would have to seek help and say, oh, this might be pneumonia. So it from an individual perspective, from a layman perspective, these are the signs that I would look for: is how sick you feel. If you are a caretaker and somebody's older individual, and if they start getting confused, if they get very weak, stop eating. Same with children's. If they are still functioning at some extent, but if they stop functioning, if they stop eating, those are the red flags when somebody has to concern that this is a lower respiratory tract infection, because symptoms sometimes may not give us an exact clue.
Okay. Yeah. And this question struck me when you were speaking about how we differentiate between the other normal cough and fever. So, especially during the times of COVID, when it presented like in viral pneumonia, there was a lot of spread of fear amongst people, and know about how deadly it can be. And I think that's when the awareness about how an respiratory infection can cause such death, rose among people. So, and how, according to you, as an infectious disease clinician, as the perspective of doctors and say the common public changed regarding pneumonia post COVID?
I think it brought a lot of awareness, first of all.
Mm.
So There are a few things that happened during COVID, right? One is from physicians' perspective. One of the unique thing happens. Not only physicians. I'm talking about any healthcare worker involved in patient care. Unique thing happens is first time, probably in last 100 years, um, as caretakers, there was some concern that I can get sick from the same disease that somebody else is having, in a very pronounced way. Because we usually, uh, as healthcare workers or physicians, we somehow learn to step ourselves aside and say, oh, this is something outside of me. This cannot happen to me. So I think that also put a lot of strain and stresses on the healthcare system and how everyone operated, because it was not the same routine, even though, as healthcare workers we are considered pretty resilient and see all kind of illnesses and diseases. So from healthcare workers standpoint, that's something change. I think from general um, public perspective, from an individual perspective, this awareness, uh, one awareness that the respiratory infection can get severe enough to uh, to be life threatening. And second is this concept of contagiousness, which if we see in a, um, I'll give you an example. Over the years, we have seen influenza outbreak, okay, especially in US in winter, and we see influenza numbers going up. Now, most people who are healthy, they get better at home. They get a little cold, and they feel sick for 2 3 days. They get better. Just say I had a flu. But what we see on the other side as physicians in the hospital is when they have those minor symptoms, and then they go and visit their family who are elderly, maybe at their house or maybe at the nursing home. And now that elderly gentleman whose immune system is not the same, when they get influenza, they get much sicker when they come to the hospital, and it it's like falling from the cliff. The, when you are in the that chronic health issues within elderly in an elderly individual, when one thing happens, it leads to some 10 other things, right? So they get admitted to the hospital, and that leads to other issues related to their health. Now, what happened with COVID is now suddenly people realize that I can make somebody else sick, which that awareness was still lacking. Even though the flu for them, it was not a big deal, that became a bigger deal for somebody else when they transmitted that to somebody else, right? So the same way, I think with COVID, what happened is there is increased awareness that if I'm sick with these kind of symptoms, I should probably stay away from others and not make them sick, because they might get much severe disease, because that's what we saw during COVID, right? A varied spectrum. Some people just got some nothing, some people got a little bit symptoms, and some people got a lot more symptoms, a lot more trouble with it. So, but at the same time, I think post COVID, there is some complacency has come along, where we get used to things. So I think the lessons we learned during COVID, lessons like this should still should still stay with us, stay with us.
Yep, definitely, as you said, during the COVID time, not only did people get aware about how to protect themselves, also how not to spread to others. I think the empathy quotient raised, undergoing the sufferings. So, yeah, and coming into the aspect of prevention, how do you think can one, like in a preventive manner, stay, away from pneumonia and other respiratory disorders. That's it.
So, I mean, pneumonia, just like any other infections, has a lot to do with um, how we respond to the infection and the organism, right? So, if we um, look at it from an individual level, I think there are two aspects to it. One is an individual level, and then the another one is a global administrative aspect of it. From individual level, um, so as we know, pneumococcus is one of the most common bacteria causes pneumonia, right? And vaccination would be the one thing that all can do for pneumococcal vaccine is available, which all of all of them can do, but that is recommended for um, age above 65, and then somebody who has other chronic medical lung problems or other chronic medical issues like diabetes or hypertension. So vaccination is important because we know that even though it may not completely prevent pneumonia, at least it will prevent severity of the pneumonia as well. The same way, influenza vaccine. Um, I mean, we saw the effectiveness of vaccine during COVID pandemic as well, right? So vaccination is important. The other things are things which we can do to improve our ability to fight such infections. So uh, obviously, simple things like smoking, alcohol, right? Um, and then the other big thing comes up is lifestyle. So health, we usually say exercise because let me put this in perspective from pneumonia standpoint. From exercise standpoint, as long as things are keep moving, right? Even if you acquire a pathogen in your respiratory tract, if somebody is bedridden at the nursing home, if somebody is bedridden at home who is elderly, they're not going to be able to move those secretions within the lung, and the bacteria has more chance to multiply and cause more severe infection. So simple things like breathing exercises, physical exercise, uh, immunity interventions that one can do, managing stress better. We know that the stress uh, has impact on immunity level on how we can fight the infection. That is well proven now with how um, immunity is affected with uh, stress, and there is a scientific reason behind it, which is out of the um, context of this discussion because that's a long discussion. But we know stress is an important factor. Sleep is another number one thing. Adequate sleep helps us maintain our immunity level. That is very important. Of course, nutrition and diet, especially that is more important in children because if we look at it, the impact of pneumonia in children, undernutrition is a huge factor contributing to pneumonia in children. But these are the simple things can be done as an individual level to prevent pneumonia. From a global aspect, there have been data on pollution, air pollution. Certain parts of the world do not have adequate resources to help combat pneumonia. And that includes antimicrobials, or again, it comes down to adequate nutrition. Especially for children, breastfeeding has shown to be very effective in preventing pneumonia in children because the immune system from mother transmit those antibodies that are required for the children. So from the global aspect, this awareness that these aspects are important in preventing pneumonia is something that has to be done at a higher level, at the administrative level, to provide resources where they are not adequate resources available. And of course, air pollution, passive smoking is another big factor. So these are the things, but at an individual level, um, simple things is a healthy diet, exercise, stress management. There have been studies where they have studied yoga and meditation, especially during COVID time, where there are several studies done on yoga and meditation on how people who practice meditation and yoga, how they were able to cope with the pandemic versus who did not or who were more stressed, right? And we have seen that people who practice some of these things, they were able to stay healthy much more likely. At the same time, their severity of illness was much lower as well. So these are the things I think to keep in mind when we talk about prevention.
That's interesting how you mentioned that no yoga and meditation and also maintaining a proper lifestyle uh, increased how a person can fight against getting these infections. So it pretty much reminded me of this homeopathic principle too, that I think the medicines which we take is all just like a catalyst. I think the body is the thing which heals itself. So when we maintain a proper lifestyle, I think our body remains healthy.
That is very true. It's often we um, from my perspective, from allopathic infectious disease perspective, right? We often see patients with uh, neutropenia when they get cancer chemotherapy and they have no white cells. And one of the things we try to explain to the family when they are very sick is the fact that antimicrobials can try to kill the organism best it can, but it is our own immune cells are much more potent, much more capable of fighting an organism. And then this is a simple example we see that patients with not having that immunity level, they don't respond no matter what antimicrobials you give, right? So at the baseline level, uh, if you maintain your health in that direction, that that's a huge that's a huge step uh, towards the prevention.
That's it. So, and Dr. Kunal also wanted to ask about this. You know, the entire topic being about this World Pneumonia Day. And the theme for this year's World Pneumonia Day is championing the fight to stop pneumonia. Right. So, could you please shed some light on this theme which WHF is kept?
So the way I understand that is WHO has a very broad vision uh, of this aspect because pneumonia, despite of advent of um, antimicrobials and all of the resources in healthcare and expertise and technology advancement, in children it's still one of the most leading cause of death. In adults, it's still, I believe, it's fourth or fifth leading cause of death worldwide, right? So, uh, we shifted from infections to health to I'm sorry, to lifestyle related disease as a leading cause of mortality and morbidity in the world, right? But somehow we missed out this pneumonia part of it, and because that's still one of the leading cause of ill health, um, and even death, right? So I think one of the big initiative from this theme is to first of all bring that awareness that this is still there. This is still one of the leading cause, and and whatever we can do in order to prevent and treat better, because the antimicrobials advance is not a problem for the most part. But I think uh, some of the challenges we face in more developed countries is antimicrobial resistance, and then in some of the other countries we face a problem of resource uh, availability, of not having some of the antimicrobials. So I think that balance has to shift in some way, and um, this idea of stop pneumonia, and I think the another slogan that is every breath counts, um, is what I was looking up, is all has to do with increasing awareness, and um, from an individual level on how you can keep yourself healthy, and second to from the standpoint of the countries and administrators to figure out ways to spread this awareness, spread the resources, uh, in order to bring the numbers down. I mean, if you ask me, we cannot stop pneumonia because I don't think it's. I mean, it is. If you look at the human body, it's not physiologically uh, possible, because there will be things like that, obviously. But how we can bring those numbers better, right? I think that's what it comes down to.
That's a very well way of putting that theme, the motto behind the theme. In order to spread awareness and also strike balance between the antimicrobial use and managing one's own lifestyle. Right. So when it comes to treating, I think during COVID time especially, there was a in widespread use. I mean, overdose of antibiotics mostly in the initial phase. Not knowing how to combat it. So, as an infectious disease specialist, so how would you suggest that we can, make a proper or right use of these antibiotics?
So antimicrobials use to some of us who practice infectious diseases, it's a science of precision, um, where um, it's like um, hitting a nail with the hammer. It has to hit right where you want it. If you keep hitting the hammer all around, it just doesn't work. And um, so it's a science of precision, is what I would say. This awareness of uh, what we are using this antimicrobial for is very important. We all understand and know that viruses cannot be killed by antibiotics. It's a general statement. Um, so when we use some of these antibiotics or antimicrobials out of fear that, oh, we have to do something to help the patient, I think that's at least in my experience one of the common reasons why some of the antibiotics are prescribed. It's not, um, and it's probably across the world. I have I witnessed that in US. I have witnessed that in India, um, where it's something where a patient comes to a physician, right, and they know that this is an upper respiratory tract infection related to a virus. It can be a flu, or it can be a respiratory syncytial virus, or para-influenza, whatever else that is. There is this need of, I need to do something. Um, that urge is very difficult to control, um, but somehow we have to understand why we are doing what we are doing. And I think if we start thinking about that, then it can help the patient as well. Now, the other idea to understand in a different way is, why do we have all this antimicrobial resistance, right? Now, in order to understand that, what science has provided us in last 15 years is the understanding of how the human system is um, full with microbes. So there is a lot more research that many of us are aware now in last 15 years, especially last 20 years, uh, on something we call human microbes or human microbiome. So even for respiratory infections, for example, we used to think that it is about, the the body's ability to get rid of the organism through the cilia or the secretions or movement of secretions, providing antibiotics. But now we know that there is normal. It is normal to have microbes within the lung as well. Uh, the biggest area where we have microbes within us is our gut. That's a huge organ, right? So, and then one wonder, why do they why do they become resistant to many of the common bacteria, right? So if nature put in those microbes within us, there must be a reason for it. And in last 10 years, 15 years, research is telling us what the reason is. And the reason is that they have this very fine, subtle interplay between our cells and genes. And that is now associated with so many other chronic medical issues, diabetes, kidney disease, cancer. Um, so now we have a lot more understanding of why these microbes are so important. That also gives an answer of why they learn to become resistant. It's just like anything in nature, anything in universe has this survival instinct, and everything has some sort of degree of awareness or consciousness. So these microbes also has some consciousness. That consciousness teaches them how to become resistant to certain antibiotics. I mean, fascinating is they also teach each other. They transmit this genetic material from one bacteria to the other, and then they learn how to become resistant and teach each other, right? But the reason probably is they evolve because they are necessary to be there within our system as well. That's why they are designed to evolve. So when we talk about antimicrobials, we have to be vigilant, judicious, and careful that what we are using it for and why we are using it for, considering all these other factors, that it would potentially affect the other aspect of somebody's health if we are just using it without a strong indication for it, without a proper indication for it. There are studies done where somebody who gets exposed to, it was a huge study with, I don't remember the exact number, but 10,000, 15,000 sample size, right? And then they saw over the years that people who got more exposure, repeated exposure to antibiotics, after several years, their risk of certain cancers was high. And now we understand the science behind it, because it has to do with the interactions with our immune system and how our immune system changes and misses those cancer cells which are multiplying and unable to kill them. That's when the cancer grows. I mean, we have seen certain viruses associated with certain cancers, right? Hepatitis B or hepatitis C, right? So that's HIV. It's the same concept. So it happens that I think in November, WHO also um, mentions that, I think sometime probably this week is where they have this notion of uh, antimicrobial awareness week. I believe antimicrobial awareness week is what WHO recommends, where they say use the antimicrobials with care. So I think knowing all this, we just have to use it wisely. That's all it is.
It's wonderfully put. Just not the intention doesn't matter alone. I think the goal on how to use it precisely also matters. And yeah. So as you were mentioning about this microbiome, I remember that you had written an article last year at the Heartfulness magazine on the topic "Message from a Microbe." It's where you had mentioned about how it, no, our thoughts and emotions subtly affect this pattern in which the gut microbe function, and also how it plays a role in our physiological and immunological system also, right? So now, how do you think, being the core of this, how the microbes act, our emotions and thoughts, how do you think can influence the immune system?
I mean, we know as an observation, probably for a long time, that somebody. I mean, very mundane example, right? Somebody who is stressed and anxious is going to take longer time to recover versus somebody who is in very good spirit. I mean, as doctors, I'm sure all of us, or even when you get sick, um, we all have observed that as a simple association, that when I approach this in a very calm way and accept the illness and handle that, they cope with it much better. They probably get better much faster. So that was just an observation. Now, the wonderful thing about science is uh, that we are finding the reasons for it, uh, of why that happens. And I think COVID was one of the good example, uh, when this was probably more observed in a larger way. It's like something you see is a small picture, but now you have like the big picture in front of you, right? So I think that's what we saw during COVID time, where um, we saw uh, some people who were otherwise healthy, but they were so stressed. And I have seen that in some of my colleagues, where they were so scared. Their disease severity was different compared to um, somebody who is maybe not in the same status of health, but their attitude towards that was different, and their course of illness was different. And you can connect that with this microbe, right? um, and that's I think that's why it came. That's probably why it came out as a message from microbe. um, and so how does that get explained with gut microbes, right? So physiologically, um, many of the pathogens that we acquire, including COVID, they often get presented by our cells to our gut. And as you know, we have this millions of bacteria and fungus and so many other organisms within our gut. And somehow they react when this foreign object comes. Then they react. They tell something to our immune system, and that result in our immune system reacting in different way. If we simplify this much more, either we have something we call a pro-inflammatory chemicals, cytokines as we call this, or we have anti-inflammatory cytokines or chemicals. Let's put it that way. Um, Whatever that happens, when this pathogen is presented, you need a balance between those aggressive chemicals, which is going to kill the organism, versus something which is going to keep it in balance, right? To simply put it, if you have an infection, If somehow we can get a balanced immune response, we're going to do much better. If it's an underwhelming response, it's a problem. If it's an overwhelming response, that's also a problem. Remember COVID, we used to give steroid. That was the primary stay of treatment, which stayed from the beginning to the end. Only thing that's doing is trying to balance that immune system in some way, but it's not 100%. So it was that unbalanced immune response which caused the problem during COVID. And these gut microbes are very important in resulting in that balanced response. And they react to our emotions because now we know from science there's something called gut microbiome brain axis, as we call it. As many of you are probably aware, it's called gut microbiome brain axis. That means um, our thoughts and emotions that can release some chemicals from our brain, especially the stress hormones, and that affects this gut microbes in a negative way. In turn, that negatively impacts how we react to some of these infections. Either it's going to be a balanced response or unbalanced response. That has a lot to do with it. So, when you go and for an exam, right, and when you go and you have to give a talk or something, right, there's some nervousness, and then we feel that in our stomach, even as a mundane thing. That is just a very simple example of it, but there is a lot more happens at a very subtle chemical level. So then imagine that if you're always in a stressed situation or stressed within yourself, that does affect our health. And if you add the inappropriate sometimes use of antimicrobials, I mean, imagine what can happen to the health with those two things. So the idea of sharing that is, we know that there are subtle things that happen because of our uh, mental state, our mental wellness, mental well-being at physical level, which may not be visible in the immediate future, but in the long run, that does affect our health. So whatever we can do to help us cope with the normal stresses and strains of the life, um, it it helps us keep us healthy.
So very beautifully put, and it reminds me that no, the gut feeling is not a joke. So we just need to keep in touch with it. And one last question which comes to my mind, like, can you quickly just say some three techniques or points which you practice in your life in order to take care of this gut microbiome?
So so there are three, I think, two major things that affect the gut microbiome. The environmental factors, there is a lot to it that we cannot control. The food, where we get the food, and those other things. That that reminds me that there is a lot of attention to organic foods and using less antibiotics and pesticides when we grow food. But when we put antibiotics within us, if it's necessary, especially if it's unnecessary, we forget about the whole thing, because that probably affects us big time. Anyway, to answer your question, so diet is a big deal. Now, what we need for that is a diversity. So within the diversity of the microbes is the key to the healthy gut microbiome. Um, so diet is important because that provides us that diversity. It helps us grow that diversity within. And so, green stuff. I mean, if you talk to a cardiologist, he's also going to tell you the same thing, right? But I think there is more subtle reasons behind it um, than we know of, based on the research that we have now. So all the green stuff, fruits and vegetables, that is very important in promoting healthy gut microbiome. And second thing is, some people prefer to take probiotics. Probiotics will have limitations. I don't think it's anything wrong. I don't know if there is any one better than the other, honestly. Um, but it it helps at some extent, but it's not all, is what I'm trying to say, because it doesn't. You can only formulate a certain kind of bacteria into a pill, essentially. And so you don't have that diversity. So we shouldn't have a complete reliance on that. But it's a good thing. It's a good thing. But I think the diet itself is important. Um, Second thing, which we don't know truly if it helps or not, the there are different data out there. There is some evidence, there is some not. Is of course the moderate exercise, but of course it's something that's going to help anyway. And the third thing is the stress management. So we know that if there are two things that affect other than the antimicrobials, um, to have the healthy gut microbiomes, or in general the microbiomes within us, is a stress. Because there's a condition described as something called dysbiosis. That means there is, um, at a molecular microbial level, the gut microbiome is not healthy. It's called dysbiosis, and one of the number one cause of that is stress. So, um, for me, I'm a long time heartfulness meditator, heartfulness trainer. So, to me, I have found meditation to be the most effective tool in not only stress management but preventing stress in the first place. Because if we practice calmness, somehow it percolates within us, and then we learn to then we become calm despite of whatever that comes, right? That's what meditation does in very simple way. um, so meditation practices are very helpful, at least what I have found, especially during COVID time. I found, like, this is this is most effective than I ever imagined, actually. And if you extend this thought of how every cell within us, including the microbes, react to what we are feeling and what we are thinking, um, I believe that when we are in a calmer state of mind, um, those cells, those microbes also vibrate at a different frequency. And that is just my personal observation. Um, and it's just every cell within us that vibrate at a different frequency when we are in the calmer state of mind, compared to when we are in rush and when we are stressed. So I think those things to me are very important, in doing the best to keep healthy.
Thanks a lot, Dr. Kunal, for sharing those three, valuable points: diet, workout, and meditation. So yeah, and so with this, we are coming to the end of today's session on the World Pneumonia Day. So just for the closing note, I would want to share my thought that it's very important to follow this, that when you change the way you look at things, the things you look at change. So I hope this session brings some change in perspective towards how we look at health and also prevention, especially. And yeah, so thanks a lot for joining and sharing your pearls of wisdom, Dr. Kunal. It was nice having you. Thank you.